Hi, I am Girish Kishnani, and you are watching 5-Minute Learnings. Welcome to the 8th video in the series on personality disorders. Today, we'll explore narcissistic personality disorder in detail. People with NPD have an inflated sense of self-worth, crave admiration, and lack empathy. Though they may seem confident and superior, they're usually sensitive to criticism. The term narcissist is often used loosely to describe arrogant or self-centered people, but NPD is more complex. It's a long-term pattern of self-centered thoughts and behaviors, marked by a strong need for attention and validation. People with NPD often have fragile self-esteem, a sense of entitlement, and difficulty forming genuine relationships. They may focus on control and protecting their ego rather than connecting with others. There are two extreme forms of NPD: 1. Grandiose narcissism, marked by arrogance and exploitation, and 2. Vulnerable narcissism, includes shame, fear, and emotional defensiveness. Narcissism versus NPD. Many people show narcissistic traits from time to time, especially during certain life stages like adolescence. This doesn't mean they have NPD. NPD is a diagnosable mental health condition with persistent patterns that disrupt life and relationships. According to DSM-5, a person must exhibit at least 5 of the following symptoms to be diagnosed as suffering from NPD: inflated self-importance, fantasies about success or power, belief of being special and wanting to be with other special people, strong need for admiration, sense of entitlement, tendency to exploit others, lack of empathy, fragile self-worth, jealousy or belief others are jealous, arrogant behavior. Along with the above symptoms, people with NPD find it difficult maintaining healthy relationships, and sometimes, narcissism can lead to aggression if the person feels threatened or their ego is hurt. Every case is different. Some people with NPD may also struggle with parenting, sometimes becoming emotionally abusive. The exact causes of NPD are not known, but risk factors may include childhood trauma or neglect, other mental health issues, family conflict or attachment problems, genetics and family history. Estimates suggest that between 0.5% and 5% of adults in the U.S. have narcissistic personality disorder. NPD is more common among men than women, possibly due to cultural or social influences. Treating NPD can be difficult. Many people with NPD don't believe they need help and may blame others. They may also be suspicious of therapists or react angrily to perceived criticism. Therapy options include cognitive behavioral therapy. CBT helps change negative thought patterns. Dialectical behavior therapy. DBT focuses on managing emotions and interpersonal skills. Transference-Focused Therapy uses the patient-therapist relationship to explore inner conflicts. Often, people seek therapy not for NPD, but for issues like depression. Even then, many leave therapy early. Medications. There are no FDA-approved drugs for NPD itself. However, medications may help with symptoms such as mood swings, anxiety, or depression. These can include mood stabilizers, antidepressants, antipsychotics. Coping with NPD is hard, both for the person and those around them. People with NPD often don't recognize the problem. Being in a relationship with someone who has NPD can be painful and emotionally draining. Relationships often follow a pattern: idealization. The person is overly loving and affectionate, known as love bombing. Devaluation. They begin to criticize, withdraw, or manipulate their partner. Discard. They leave the relationship, often moving on to someone new. Protecting yourself. If you're in a relationship with someone with NPD, watch for signs of abuse. It can be physical or sexual, emotional or psychological, verbal or financial. NPD affects many areas of life, including work, relationships, and family. While treatment is challenging, therapy can help if the person is willing to engage. If you think you or someone close may have NPD, seeking professional support can make a real difference in managing symptoms and improving relationships. That's all for today on narcissistic personality disorder. In the next video, we'll explore avoidant personality disorder in detail. Hope you found this video helpful. If you liked it, please give me a thumbs up, and follow or subscribe to my channel 5-Minute Learnings. And do remember to hit the bell icon to get notified of new content. Thanks for watching.